So my name is Stefanie Auer. I work here in Austria as a clinical and health psychologist at the Austrian Alzheimer Hilfe, and also I am a professor for dementia studies at the Danube University in Krems. This is my team that is responsible for today's presentation, and these are we have 70 team members at the Alzheimer Hilfe that is actually working within the model of the Dementia Service Center, and I thank them all very much for their wonderful work. These people are mainly psychologists, social workers, and our educated trainers that we build up, that we educate in our academy. Throughout the years, we were financially supported by several funds, the Austrian Health Funds, in the county, the National Bank, the Social Ministry. So it was a long-term project starting in 2001. So a lot of institutions contributed to the success of this model. Today, I want to present on the methodology of the Dementia Service Center model, and also will try to answer the question whether dementia service centers are structures that are feasible to be seen as structures for timely diagnosis. We have the situation in Europe today that actually very few people receive a dementia diagnosis. The OECD provides information that really only 40% of countries, of OECD countries, so to say, can provide information how high their detection rate in their respective countries is. And to my knowledge, the country with the highest detection rate seems to be Scotland. This is information from 2012. I suppose they are even higher today. For Austria, I have to say that the detection rate is really still rather low. In the cities, we have maybe 30%, but on the countryside, the detection rate and the dementia diagnosis rate is rather low. We know today that early disease detection or timely diagnosis and the treatment is very meaningful and can really change the quality of life, improve the quality of life for people with dementia. So investing in an early timely diagnosis is an important issue. Timely diagnosis, here are some examples of advantages. Timely diagnosis can prevent crises and promote the disease adjustment for each person, improves the quality of life, prevent institutionalization, facilitates the referral to specialist services and appropriate care. And last but not least, it is able to saving cost. And I will go into it in my presentation, why this is. Diagnosis should not be the end, but the gateway to making it possible that a person affected by this disease can make informed personal choices. Diagnosis can provide access to a full range of treatment options that we have today. It's pharmacological and psychosocial. And from our experience in our treatment structure, we can report that pre-diagnostic counseling, so to say, to prepare people that are worried about their memory, to provide them with counseling services is a very important first step for a timely diagnosis. Persons with dementia can benefit from psychosocial support. Also the support providers, and there's a lot of evidence by now that really support these statements. The sad thing is that really only 40 90% of new scientific discoveries or really good ideas enter practice. To implement new ideas in practice is actually a quite complicated process. Why is that? There are a lot of hurdles to early detection still today in place. We can say that the general stigma within our societies and the healthcare professionals is still prohibiting people from coming forward and wanting to confront a diagnosis. And traditional structures very often do not meet the needs of persons with dementia and their support providers. They are not prepared for the worries of families and persons that are worried about their memory. So we started an initiative in the middle of Austria in a really very remote rural area, where we took all these ideas and tried to create a new model of care. And we published this new model widely, internationally in different environments. The Dementia Service Center model became the heartpiece of the Austrian dementia strategy, as it fulfills most of the goals that were defined within this strategy. I say the best things first today in my presentation. The success of our model led to the dissemination of the model of the Dementia Service Centers. This year, 2020, in January, the model of the Dementia Service Centers was rolled out throughout the county of Upper Austria, in a sense that a network was founded that is called Dementia Upper Austria Network, and several, and this is really something that I'm very, very happy about, is that several different care organizations gathered together to really fulfill one goal, to provide similar and the high standard quality psychosocial support for people with dementia under the roof of the Dementia Service Center model. There was a pilot financed by the National Insurance Company, the Austrian National Insurance Company, and this pilot project was ran from 2013 to 2015, and several tests were undertaken. Here on this slide you can see for the section of people affected, persons with dementia and their caregivers, it was found that life quality for both groups was improved, behavioral problems were reduced, and the progression of the disease, there are some data that point in this direction, that non-pharmacological treatment is able to prolong the early phases of the disease and shorten the later phases of the disease. Caregiver burden was found to be relieved through the intervention of the Dementia Service Center. For the health and social care system, it was found that it optimizes medical resources and prevents double strategies. Synchronized standards for Upper Austria were found, and the take-up rate was improved. So more people were searching help from the Dementia Service Center. And it's an effective, concluding, it's an effective and affordable service. Currently, there are 11 dementia service centers spread throughout the county of Upper Austria, and there was a systematic to it. Each family in the county should be able to reach a dementia service center easily. In the development of the model, we tried to follow the guidelines of the MRC steps. We developed a treatment model. We constructed a manual for replication of the model, where each of the service elements are described in great detail. We made a pilot and feasibility study and another pilot study from the external partners, and finally the implementation of the model. The basic definitions that guided us for the development. What is a dementia service center? A dementia service center is a multi-component, low-threshold, one-stop shop where psychosocial support is provided and is specifically addressing the needs of persons with dementia and their families and support providers. Therefore, the main goal of the Dementia Service Center model is a timely detection of dementia, at best global deterioration scale 3. It is thought to delaying the institutionalization of persons with dementia, and it should reduce the burden of the support providers. All elements of this model were developed in close cooperation with people with dementia and their support providers in a co-creation process. And so focus groups were founded in the beginning of the model development in order to assess the needs of persons with dementia and their support providers. And the main results of the focus group discussion, mainly based of the group discussions in 2001, was that we found there was very little public awareness, even within the community of medical specialists. People were asking, when is the right time for my diagnosis? They voiced the need for information and support. We found a very high motivation for home care. So it is a pleasure for most caregivers and support providers to really care for their relatives. They just need support in doing this. They complained about the fragmentation of the services. They also admitted that they were ashamed of accepting help because of the stigma. And they pointed out that services should not be generalized, but they should really look the individual needs of the persons. And they pointed out to us that there are different needs in different stages of the disease. So therefore, we took all these insights from the community of people with dementia and in their support providers, and made this model of the Dementia Service Center, focusing really on the timely diagnosis, because this was one of the main points, and the awareness building. With respect to the service, we focus on screening for cognitive deficit, treatment, psychosocial treatment, networking, and the whole service is embedded in a long-term relationship with a person with dementia and their care provider. The features of a dementia service center are concluded here on this slide. It says that the Dementia Service Center is specific to dementia, so it doesn't provide counseling for other illnesses. It is really a special expertise to help caregivers and persons with dementia throughout this illness. We focus on pre-diagnosis counseling, since about 40% of people that visit a dementia service center do not have a medical diagnosis when they first contact our centers. Long-term support is an issue. Right service at the right time is the main point here. So it is the task of the Dementia Service Center to make sure people receive the right service to the right time, and they are stage specific. One feature is an easy and low threshold access, so there should be no administrative hurdles, little travel time, and make it as easy as possible for the families to be reached. The spirit of encouragement is referring to a positive life concept despite dementia. So people that are visiting a service center should be able to develop a positive outlook on life despite the diagnosis of dementia. One-stop shop is a very important point where all the wonderful services that are already available really reach the care provider and the person with dementia. So the caregiver receives bundled service and information at one center. Public relations is a very important issue, fighting stigma, making sure that people with dementia find their places within society and are welcome within society, because this is also guaranteeing that people can stay at home much longer. Research, last but not least, is a point that is always difficult within this environment to find funds, but it is an important issue in order to continuously improve the services and make sure that the quality stays. One of the hard pieces of the Dementia Service Center is the stage-specific retrogenic training. Another hard piece is the training modules for the caregivers, where the caregivers are informed about the disease, they can ask questions, learn about principles of communication, doing meaningful activities at home, and are informed about their social rights and making sure that they understand why they need respite themselves. We have a database with quite a few variables, and one of the main issues in our database is the global deterioration scale, where we can track the disease severity and communicate within the teams in the Dementia Service Center. There are mainly three different professional groups working in a Dementia Service Center. There are clinical psychologists, social workers, and MIS trainers that work with the families on a daily basis, and they are leading the training groups with people with dementia, and those are the ones that provide guidance in daily life. Awareness building, a very important issue, fighting stigma, promote social solidarity, and ease the social inclusion. We are making sure that we are very often in the newspaper, TV, making really the topic of dementia a public issue, and involving very famous actors, for instance, is also a tool to bring dementia into our society and make the topic dementia a positive one. Educating different professional groups is, of course, a very important issue to prepare society for people with dementia and their special needs. Here's an example. The task force of the police is educated within an e-learning program, and 12,000 police officers have been trained already, and there are more than 200 dementia-friendly police stations. So now to the question, is the Dementia Service Center a structure to really reach people early and making a timely diagnosis possible? We made an analysis recently, well, in 2017, last time. There's some more recent data, but I will present those. We have over 4,000 data sets that underlie this analysis. We included people with memory complaints, no medical diagnosis, and persons with a diagnosis of dementia at all stages. Just that you get an impression, about 60% of our participants do have a medical diagnosis by now. This hasn't been always that way, so it's really quite impressive that this has improved. The main diagnosis is, of course, Alzheimer's disease, followed by unspecified dementia. The remark is 40% have no medical diagnosis yet. But at the end of the day, 80% of our participants do have a medical diagnosis throughout the treatment phase. We use the global titration scale, the 7-point scale, describing the disease from no memory problems to very severe dementia. So we use this scale to track the dementia severity. And here's the result of our analysis. And as you can see here, people really come to a dementia service center in the very early stages of the disease. Already with subjective complaints, we have quite a substantial group of people seeking help and advice in a dementia service center. So we are visible as a institution where you can turn to when you are worried about your memory. Mild cognitive impairment is already a bigger group, and beginning dementia is the biggest group. So taking together the pre-dementia stages and the beginning stages, this is the biggest population that is reaching out to a dementia service center. And the same picture is seen for the mini mental state examination. We have a very low institutionalization rate. That is also something that we would like to take a look into much further. It's very complicated actually to analyze, but only 20% of our population is institutionalized. And at the end, I want to show you a new publication. We were looking at the cost in the different stages of the disease, and we're just starting to analyze the dementia service center from the cost perspective. Of course, what you can see here on this slide is very clear. The cost driver are severe stages of dementia. So the investment, my conclusion, and this is of course something that needs to be discussed, my conclusion is that the investment in very early phases of the disease is a very, very important one, and this cannot be stressed enough, to start initiatives that give people the opportunity to early invest and give them the opportunity to come forward and make preventive strategies. So we have to teach people really in prevention in order to avoid these very, very costly, severe phases of the disease. Concluding, the Dementia Service Center model was developed using MRC steps. The development of this model led to implementation due to its success. And we can see the effect as an early detection model very clearly. So people really see a low threshold institution and center such as the Dementia Service Center as a possibility and chance. Attaching measures to complex structures such as a Dementia Service Center provides opportunities for model development and implementation. With our longitudinal data protocol, we are continuously able to inform decision makers and stakeholders. And it gives a huge opportunity for research and collaboration on this issue. I thank you very much for your attention. I hope I didn't go over time. I see I didn't. And I wanted to invite you to our, now you turned me off already. Thank you very much. I want to invite you to our conference in Krems that will also be virtual.